In this video, you will learn about the processes and tests performed in the tissue processing techniques in histopathology laboratory. Histopathology focused on the study of biological tissue for diseases under macromicroscopic examination. The examination is done on biopsy or surgical specimens by consultant pathologist that focuses on the study and analysis of biological molecules at the molecular level for medical and clinical purposes. This plays a crucial role in the diagnosis, monitoring, and treatment of various disease. Histopathology is the diagnosis and study of diseases of the tissues and involves examining tissues and/or cells under a microscope. Histopathologists are responsible for making tissue diagnoses and helping clinicians manage a patient's care. In the histopathology lab, there's a meticulous process for receiving and handling specimens. Upon delivery, each specimen is accompanied by a completed requisition form, containing vital patient details such as name, age, and medical record number, along with clinical history and physician's name. Lab personnel carefully cross-check the information on both the requisition form and the specimen container, ensuring accuracy. The container itself includes critical details like the patient's full name, medical record number, and specimen type, as well as the date and time of collection. This meticulous process guarantees accurate specimen handling and maintains the integrity of the diagnostic process. Specimens and requisition forms undergo thorough double-checking before acceptance. Data is then swiftly entered into lab records, and specimens are labeled accordingly. In the grossing step, specimens are meticulously inspected, described, and sectioned to extract the most diagnostically valuable tissue. Pathologists rely on this detailed gross examination to provide crucial insights during microscopic evaluation. Using sharp knives or saws for soft or hard tissues, respectively, the tissue is carefully cut and placed in plastic cassettes for fixation. Fixatives play a vital role, preserving tissue architecture and thwarting enzymatic degradation, ensuring optimal conditions for accurate diagnosis. Tissue processing involves dehydration, clearing, and infiltration, taking tissue from fixation to embedding for section cutting. It can be done manually or automatically using machines like automatic tissue processors. These machines offer efficiency and convenience, moving tissues through chemical agents on a preset timescale. After tissue processing, the specimen is embedded in wax for section cutting. In an embedding station, it's placed in a mold with molten wax, topped with a cassette, and cooled to form a block ready for cutting. A microtome is used for cutting thin tissue sections for microscopic examination, known as microtomy or sectioning. After cutting, tissues are floated on a warm water bath to eliminate wrinkles and distortion, then transferred to slides. This intermediate step allows tissues to relax and adhere to the slides. Water baths are heated slightly below the paraffin melting point, typically at 40 to 50 degrees Celsius. The goal of microtomy is to produce artifact-free slides for histological analysis. After slicing tissue sections, observing them under a microscope poses challenges due to their colorlessness. Staining is crucial to enhance contrast and reveal tissue structures. Automatic staining machines in hospitals ensure consistent and standardized procedures, reducing variability between technicians. Following staining, proper mounting is crucial for preservation and long-term storage, ensuring stained tissues remain intact and accessible. This involves applying a transparent mounting medium to eliminate air gaps and preserve optical clarity. Proper slide storage, with clearly labeled racks, facilitates easy access for future examination and analysis.
This project was developed in collaboration with Molecular Biology Lab, Inquest Pathology, Sendirian Berhad, with consultation and use of facilities for video recording.